Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan and my mission is to make psychology accessible to all. In today's video, we're going to talk about psychotic disorders, but through the lens of later adulthood and some of the things that might manifest. So let's get into it. So as I mentioned in the previous video, some of the disorders that occur in later life, they occur across the lifespan. So things like anxiety, depression, substance use, and so forth, they do occur across the lifespan. But what I want to do is put a spotlight on what it looks like in later life. So we do see that older adults have higher rates of psychotic symptoms than younger individuals. But many of these cases are linked to medical conditions, things like a delirium, which I'm going to talk about in my next video, or a form of a dementia, which we now refer to as neurocognitive disorders. So that's usually how they will manifest, but that isn't to the exclusion of some people. They do legitimately have schizophrenia, and others have delusional disorder, and these conditions we have to be mindful of as well. So let's take a look at schizophrenia for a moment. Schizophrenia is actually less common in older people relative to younger people. In fact, we see that the symptoms, particularly the positive symptoms of schizophrenia, lessen in later life. So things like hallucinations and delusions, they tend to subside to some degree. And it is rare to see newer cases of schizophrenia occur in later life, except in the case that we mentioned. There are like organic or medical issues that could induce psychotic states, but that is a rule out when we look at schizophrenia. And let's also talk about the other one, a delusional disorder. So a delusional disorder is when a person develops false beliefs, but they're not bizarre, right? So delusional disorders do not have the same extreme nature as schizophrenia. This disorder tends to be rare in most age groups, but it increases with age, right? So unlike schizophrenia that decreases with age, delusional disorder can increase with middle to late adulthood. And there are different hypotheses as to why this occurs. Some suggest that this is due to deficiencies that develop in hearing. So, as a way of overcompensating, this might occur. It could be due to social isolation, stress, poverty, and so forth. Each of these conditions can create a sense of delusions. So those are psychotic conditions. So if I were to do a take-home message, you should have been able to distinguish between medically induced psychotic states. You should be able to understand the rates of schizophrenia decrease with age, but the rates of delusional disorder increase with age. And you should be able to identify some reasons for each of those. So that's the video. It's a relatively quick video. I hope you enjoy it. I hope you learned something new. And if you did, please hit the like button, subscribe, click the notifications tab. Each of these 3 actions will send a message to YouTube that there's some value in this video, and they will kick it out to a larger audience. But more importantly than those 3 actions is to put in a comment section if there was something that was thought-provoking or you had a reaction to one of the things that I said. Put it in the comment section. I read each and every comment, and I'd like to turn this into a learning community, so your comments matter. So until next time, take care, everybody.